This is Tracy Todd. I am the Deputy Director of AAMFT, and I have with me David Cordova, a Minority Fellowship Program alum who recently got a CDC grant. So David, why don't you take over a little bit here and tell us all about this grant of yours?
Wonderful. Thank you. Thank you again for this opportunity. So this is an application that was funded from the Centers for Disease Control and Prevention. And this application aims to build capacity with respect to HIV prevention among communities of color by new investigators or junior investigators of color. And so this application, the proposed study aims to develop and test a family-based HIV and drug abuse preventive intervention to be delivered via the web. This will be an online family-based HIV preventive intervention, and it is a 4-year study. So in the first year will be spent in developing this intervention, and then the efficacy of the intervention on preventing and reducing HIV risk behaviors, including drug abuse and unprotected sex, will be evaluated over the 2 years.
That's exciting. You mentioned in there online. What's the online component? How does that work?
Yeah, so as I was doing, my postdoctoral research here at the Center for Family Studies, working on the Familias Unidas effectiveness trial, although the Familias Unidas prevention program is relatively successful at both engaging and retaining participants, I noticed that a significant number, 25 and 28%, of eligible participants were not participating in the prevention intervention for various contextual reasons. For example, work schedule, transportation, and work. And so I started to do a little bit of research on internet use, particularly among Hispanic populations residing here in Miami, and found that a significant number had reported having had access to internet, and in fact, the highest among all Hispanics in the country. And so I put together this application that takes somewhat of a novel approach at delivering HIV prevention services to hard-to-reach populations, and capitalize on this high percentage of internet use among Hispanics. And so what this intervention will consist of is it'll be delivered online versus a face-to-face. And so what it consists of is 8 sort of mock group sessions where the participants will be able to participate in this intervention through seeing these mock group parent sessions. And then 4 sessions will actually be delivered via webcam, where they'll actually be able to engage and participate with a therapist or an interventionist live over the web.
That is great. I heard you mention also you got a loan repayment grant. I submit there's a lot of people who have went after that. What gave you an edge over others, in your opinion? You probably don't know, but what gave you the edge?
Well, I think a number of factors. I think one is definitely proposing a strong research plan. So what is it that you'll be doing over the next 2 years, and how will you be advancing the field? And I think 2 is also having a strong mentor team. So I've been very fortunate to have had very strong mentors throughout my graduate studies, and currently now as a new scientist. And so it's definitely very important to also have that in place, a strong mentorship plan. And then of course in all of my applications now, one of the first things I mentioned is that I am a Minority Fellowship alumni, and definitely mention that, and definitely capitalize on that. And that is definitely also appealing to many of the reviewers, I believe.
That's exciting. And you just nailed one of the questions that I was going to ask you about, and that was, do you or did you have mentors, and how did they help you in your career and receiving this grant? So if you could speak to that, that is really great, because that was a question I had for you, and you started to touch upon it.
Yeah, so I mean, having, good mentors is definitely, important, and has been and continues to be, very important with respect to, my success both in scholarship and research. I've been very fortunate to have, mentors throughout this entire process, and including my graduate studies and mentors in the Minority Fellowship Program, and my current mentors here at the Center for Family Studies. And so I think it's important just to have an open mind and be willing to listen to suggestions and critiques, and even though sometimes it may not make sense, these mentors have already walked this path, and just being open and willing to listen to suggestions that they may have.
Well, the therapist in me is going to come out here on that question. When you say be open and listen to their suggestions, I think that's hard to do for a lot of folks, whether it's in a mentorship capacity or, in any other setting. How do you wrestle with that, and how do you emotionally and intellectually make yourself open to those kind of suggestions?
Yeah, so it's a really great question. It just, I think particularly in academia and in research, I think it's just important to to have a thick skin, and just be willing to accept critique. And I recently got a really good piece of advice that that we're in the business of rejection.
Sorry. That's good.
And it's probably one of the wisest pieces of information that I've gotten, and to not be discouraged, and to sort of approach it like if you're a baseball player, and if you're batting 300, you're doing pretty well, especially in this economic climate, and as things are getting more and more competitive, with respect to both submission of manuscripts in journals, and also with grant applications, and, less and less are now being funded. To not be discouraged by that, but just to continue to to submit and to aim high. Many of the manuscripts that I've published now, I first submitted to much higher impact journals, and they were rejected. But then I take that feedback and that review process and incorporate it, and then turn around and get it back out to another journal that's still good, and just continue that that process, and not be discouraged throughout the way. So yeah, so it is definitely has been a challenge with respect to my training as a family therapist, and the validating parts of me, and then also being willing and open to the fact that we are in a business of rejection.
So if I understand correctly, it is important to not only expect that, but to be able to have a certain level of determination to get beyond that.
Definitely. Definitely. I think once you can accept that this is just a part of the game, and not internalize it, that that it's not a bad idea that you have, but rather it's just maybe not a good fit. But there's definitely other venues which may be a better fit for your ideas, and definitely be willing to overcome those challenges, and just it's a part of the game, and not internalize it.
Well, I think that is very good advice. You touched upon another area that I wanted to ask you about, and that was advancing the profession of marriage and family therapy. And what suggestions do you have for Minority Fellowship Program fellows MFT students in general about advancing our profession?
Mm-hmm. Yeah, so, wow. We can spend a long time talking about this.
Take as much as you need.
I think, for me, I wanted to come here at the Center for Family Studies because, from my perspective, they are the best in the world at doing, family-based drug abuse research, particularly with, Hispanic families. And, this is in the Department of Epidemiology and Public Health. It's not in the marriage and family therapy program. And so, for me as a marriage and family therapist, it's, really important to advance our field and really work on the research piece and as a program, as a field, working toward improving and having more sound science. So what I would really like to see is, is a center such as the Center for Family Studies housed within a marriage and family therapy program, given that, we are the experts in family therapy and systems theory. And, unfortunately, I think as a field, we've left other professions to do the research for us. So with respect to advancing the field, I think that not only do we need to work, as practitioners, but really working toward that scientist-practitioner model. Incorporating some of these other methods, such as, methods in the field of epidemiology and public health, methods that you see within the medical field and nursing and other disciplines, and apply them to the field of marriage and family therapy. And by doing that, we really need to work on publishing more sound research, improving, the methods that we use in our field, and working to improve, for example, the impact factor on our journals, and building the next generation of scientists who will, advance the field. We need to improve on the outcomes, within our field and the such.
Well, you raise a really good point when you talk about the methodology and going to other fields and incorporating that into our area of expertise. One of the things that I'd kind of like to get your feel for is that we have, and somehow you turned the corner or you made a decision, and that's what I'm trying to get at here, that in our field, the qualitative, small sample size studies are really the dominant in terms of dissertation, it seems like, in clinical research. And somehow for David Cordova, that was not what you did. What do you think is going on there, and how can we help people see the value of the quantifiable research and the policy-driven research? More than quantifiable, for me, it's the policy-driven stuff that really is important. What did it for you, and how can we help others see that?
Well, that's a really good question. I guess, what did it for me is just seeing, other disciplines. What motivated me was just seeing other disciplines take, family-based interventions, and really, demonstrating, and developing these evidence-based models, and I was really just surprised that here we are, the profession, marriage and family therapists, and very few marriage and family therapists have developed these family-based models. And so for me, as somebody who identifies as a marriage and family therapist, it was a real motivating factor for me to contribute to our field as a marriage and family therapist, and get training in how to develop and to implement and to test these models. And that's sort of my overarching goal is to develop and test a family-based model.
How did you go about getting that training?
Reaching out to other fields who I saw were from my perspective, perhaps a little bit more successful, in developing these models and testing them. And then my ultimate goal, I've stepped away, to get that training. I've stepped away from the field of family therapy, but my goal is ultimately to be back in the field and to implement some of this methodology that I've been learning over the course of the last 4 years or so. Because prior to even taking on this postdoc fellowship, I was working with a psychologist who was had been very successful at obtaining federal funding. So I think we have to. I think it's important for us to change the culture of the field. With respect to how we perceive research, I think is something that we as a field need to work on. And although a lot of these process questions are very useful in terms of moving the field forward, I think in addition to that, in addition to qualitative research and these sort of case studies and small samples, I think we need to also incorporate some of these longitudinal methods and really begin now to test some of these theories that we've been developing as a field for the past 50 years or so. And I think we need to move beyond sort of this theory talk and now test these models.
I agree completely. I get discouraged when I go to various Hill events and see a lot of research that's about family therapy or family intervention, and as you put it, not done by family therapists.
Right.
That's discouraging.
Right, and I think that for us to work toward that goal, we really need to just change the culture of the field to also be more open and accepting of research. For me, it's discouraging to see how many MFT programs are closing.
Yes.
And I think a big part of that, the reality is that from what I understand is that many of these programs are closing because of issues with funding.
Right. That's correct.
If we could be a little bit more successful at obtaining funding and then showing outcomes, and I think we can really, build a strong argument for keeping these programs.
I agree with you 100%. You have mentioned a couple of times networks, your mentors, groups of people. Basically that's what AAMFT is. It's an association. It's a bunch of folks that get together with common interests. I just got to ask you the question: what keeps you involved with AAMFT?
It makes sense to me. The family piece, the systems piece. It's a wonderful organization to belong to, and although it's been a couple years since I've been to AAMFT, and it's sort of I've been to some of these other conferences and organizations, really to meet with project officers and to network that way. AAMFT always feels like home.
I hear that a lot. I agree with you as a member.
So, as an organization, we start to work towards more of, embracing the research pieces, and, perhaps we can also, attract some of those project officers and some of those federally funded officers and be able to really, advance the field.
Well, and make it their home, too.
Exactly.
That would be great. I have just a couple more quick questions. I know I told you a half hour, and I don't want to take up more than that of your time.
No problem. No worries.
These grants are going to help you greatly in your career and your professional development. They already have, and you have done a bang-up job. What tips on professional development do you have, first for the Minority Fellowship Program fellows, and then we'll get to the general MFT students? What tips do you have for them? Because they're looking at you as someone who is just in their shoes, just a few steps ahead of them. You're someone who's not been in the field 20 years, and you have attainable goals. You're within reach. What are your tips for them?
Just, find a good mentor. Find a good mentor and just, again, be open and willing to their suggestions and feedback and criticisms, which, could be difficult at times. But it definitely is, a growing process. And, they've walked the path before you, so, they must be doing something right. And to publish, aim high, and, if you get a rejection, just incorporate that feedback and get it back out. I think something key to obtaining some of these grants is to demonstrate your expertise in a particular area. So it's really important to start publishing in whatever area that you're interested in, and also just to narrow down your focus and what it is that you're specifically interested in learning about or exploring or examining. And choose wisely with respect to whichever projects you're going to be on, or any types of manuscripts. You want to demonstrate in your CV that you are an expert in a particular area, and you're not publishing in so many areas that people don't understand what it is that you're interested in. So your vita should look, somebody should be able to look at it and say, okay, this is what this person is interested in, and this is what their expertise is in.
All right, I'm going to kind of put you on the spot a little bit here, okay?
Yes.
I'm a marriage and family therapy student, let's say.
Mm-hmm.
I'm working on my doctorate, and I'm about to start my dissertation. And, that process is a daunting process, but I want to advance the field, and I want to do research that interests me. What guidelines would you give me?
As a doctoral student entering their dissertation, what guidelines would I give you?
Yep. You're my mentor right now.
Yes. It's very broad.
I know.
Pick something that you're very passionate about.
Okay.
Because it's going to be a long process, and really, implement sound methodology. So I think, one, you really have to be passionate about what it is that you're going to look at, and two, to implement sound methods in your dissertation work. Three, this is going to launch your career. So choose something that you sort of see yourself, not only that it'll launch your career, but something that you can build on, in the future. So don't pick something that may, seem easy or something you have access to, but something that's really going to launch your career.
Okay, so let's say I've got a topic and I'm really passionate about it. How do I go about figuring out if this is something that will truly be beneficial to advancing the profession? Because I'm also invested in advancing marriage and family therapy. What guidelines would you give me about that?
In advancing the profession, well, hopefully by the time we get to the dissertation stage, as my mentee, we would have already well figured out how we can advance the profession. One, we have to work towards evidence-based models. It's just sort of the nature that we're in now with accountability. Even with, for example, the Minority Fellowship Program, in order for it to continue to be funded, we need to demonstrate that there are outcomes. And, in addition to just graduating the fellows, I think, we need to demonstrate that it really is, working to advance the field and really, serves as a tool to advance the careers of the fellows.
Mm-hmm.
So, I'm working with a grad student, coming up with, is this really going to advance the field? So, for example, there's often a lot of times, where I hear, people in the field saying that they're interested in therapeutic processes between, client and the clinician. Is this really going to advance the field? I think is an important question to ask oneself.
Right, and if I heard you correctly in there, which I think you made a good distinction if I heard correctly, was that in my relationship with my mentors, if I'm asking that question of them, hopefully I'm getting guidance on whether it is or will not advance the profession as well as be a good topic for me. But that's hinging upon a relationship that I have with a mentor.
Right.
Got it.
Yes.
My last question should be an easy one. What's next for David Cordova?
Well, I'm working to get back into the field. Actually, my postdoc's going to end here in July, and I'm working to get into an MFT faculty position. Again, unfortunately, there are very few. But I'm thinking about the next grant now. I'm thinking about developing a family-based HIV and drug abuse preventive intervention, which can be implemented in a different context. So I got down, I have down now the qualitative methods and the longitudinal quantitative methods, and so my goal is to utilize both and develop my own preventive intervention and to work to advance the field of family therapy. How exciting would it be for a actual someone with a background in MFT to develop a family-based model?
It would be very exciting, let me tell you at this end.
Well, I'm working on it.
It would be very exciting. I'd love to be able to say, yes, we have a paper and bring you in and have a Hill event. That's my dream of someone in your position, is to be able to do these and then have them come to town here in D.C. and sponsor a Hill event where family therapists are talking about family therapy. I think that would be fantastic.
I agree. I couldn't agree with you more.
Well, thank you so much for taking time out of your busy schedule. I wish you the best of luck and congratulations again.
Thank you again. Thank you for this wonderful opportunity.
You're very welcome. Take care, David.
Thank you, you too.
Bye-bye.
Bye.